This is One-on-One.
I was diagnosed with congested heart failure, had an aneurysm. The valve wasn't working, which ultimately I had to have a valve replacement. And then I had a quadruple bypass surgery. After the surgery, I noticed a big difference. When I came back, persons in the congregations were commenting that, wow, he was running all around before, but now he done took it to a whole nother level. In that midst of that troubling time, I felt sense of comfort, I felt expertise, I felt a sense of excellence, I felt that I was in good hands.
You were just looking at Pastor James Brown, but right now you're looking at Dr. Richard Neibart, Chief of Cardiac Surgery at Jersey Shore University Medical Center. Good to see you.
Thank you.
We're looking at Pastor Brown, and he had conventional open heart surgery, right?
Absolutely.
And at Jersey Shore, right?
Correct.
Here's what's interesting. The discussion that we're having with you is about something called TAVR, T-A-V-R, Transcatheter Aortic Valve Replacement.
Correct.
Now, what's so interesting, the reason we showed Pastor Brown is that so many people have this more conventional open heart procedure, but that's not always the right procedure for everyone, and some may be candidates for this TAVR procedure. Put that in context for us.
Well, aortic stenosis is the second most common condition that heart surgeons deal with.
Aortic stenosis.
Yes. The most common is blocked arteries in the heart or coronary artery disease. Aortic stenosis is essentially a condition where your main outflow valve of the heart gets stiff and calcified over time and doesn't open and close properly, forcing your heart to pump harder and harder to pump the blood to your body. And up until recently, the only way to effectively deal with this was a conventional open heart operation with replacement of the aortic valve with either a biological prosthetic valve or a mechanical bioprosthetic
And
valve.
TAVR now can do this.
Now with the TAVR procedure, it's a catheter-based procedure where we actually put in a new valve without opening the chest.
What's the advantage in that?
Well, for patients who are very sick or elderly or frail or have multiple medical problems that would make them either prohibitive risks for conventional surgery or high risk for conventional surgery, this procedure can be done, and it can treat their aortic stenosis with much less morbidity and risk of mortality, and of course, much quicker recuperation.
Doctor, I'm curious about this. Who is a candidate for the TAVR procedure and who is not?
Well, the conventional surgery is still the gold standard for aortic stenosis. And I should make it very clear that any patient who is in generally good condition, healthy, and is considered low or moderate risk for open heart surgery should have this the conventional surgical procedure.
Right.
That is probably less than a 5% risk and has excellent long-term durable results with these biological valves lasting 15 to 20 years. However, there is a subset of patients that are elderly, sometimes well into their 80s or 90s. They have many other medical problems. They may be frail, and they're not candidates for conventional surgery. And those groups of patients are now the patients that we look at for this TAVR procedure. It is an FDA and CMS, that's Medicare-approved procedure.
CMS, that's the federal government.
Yes.
They've approved it as well.
Yes.
Let me ask you something, Doctor. In your work as the chief of cardiac surgery, how amazing is it to you that these advances are taking place right before your eyes?
This is unbelievable. It's a total game changer. I tell people that technology marches on. When I was training 30 years ago, and I should have covered my mouth, the most common...
We've seen a lot.
the most common general surgical operation was some kind of ulcer surgery. Then a little white pill called Tagamet came along, and then the 100 others in the purple pill and whatnot. And now it's very rare to operate for ulcer surgery. Even if you look at a condition like breast cancer in women, when I was training, every woman had to have a mastectomy. Now the majority don't. They can have a lumpectomy, radiation. It's totally changed the way we treat these conditions. And this condition of aortic stenosis is now being treated in a catheter-based fashion without opening the chest. And I believe, and this may be a little controversial or provocative what I'm going to say, but I believe that within 5 years, maybe as many as half the patients, 50% of the patients, will be treated in some kind of catheter-based therapy as opposed to an open conventional surgery.
Finally, a few seconds left. You think that may be the direction we're going in?
Yes, and already in Europe, countries like Germany, that number is about 30% now. In some of the Scandinavian countries, it's 20% already.
Advances keep moving forward, and technologically, clinically, and otherwise. And Dr. Richard Neibart, Chief of Cardiac Surgery at Jersey Shore University Medical Center, I want to thank you for joining us. And even though it's been 30 years, you continue to learn and make a difference in this field.
Yes.
And keep up. Thank you so much, Doctor.
Thank you.
We appreciate it.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Investors Bank, Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years. The Russell Berry Foundation, Fedway Associates, Inc., PSE&G, committed to improving New Jersey's economy and strengthening its communities. New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of Gibbons, P.C., and by Health First New Jersey. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey, and by NJ Biz, All Business, All New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.